The World Health Organization has declared Africa wild polio-free. Nigeria, the final country on the 54-nation African continent where the disease was endemic, recorded its last case more than 3 years ago. Rotary International and its partners in the Global Polio Eradication Initiative announced the WHO declaration in a statement. Polio is a highly infectious viral disease. The virus affects mostly children who are younger than 5 years of age. To discuss this now further, we are joined via Zoom by Dr. Melinda Suchard. She's the head of the Center for Vaccines and Immunology at the National Institute for Communicable Diseases. Doc, good afternoon. Thank you so much for joining us here on the SABC News channel.
Thank you for having me, and good evening to you and your viewers.
Thank you so much indeed. So I've given a bit of background on polio, but just, give us more what polio is, and perhaps also touch a bit on the effects that the virus has had on the African continent over the years.
Polio is a viral illness which infects people and can cause either asymptomatic infection or mild illness or severe paralysis. It can come very suddenly. So in previously healthy people, including children, polio can strike very suddenly and cause paralysis, for example, of an arm or a leg, sometimes of the breathing muscles, the diaphragm, in which case people can die from polio. And sometimes polio can even result in total body paralysis.
All right, so we understand that the disease once paralyzed, 75,000 children on the continent every year. I suppose what we have just witnessed by the World Health Organization a short moment ago is victory for the continent.
Absolutely. This is a really landmark occasion and one to celebrate. In 1988, when the Global Polio Eradication Initiative was first launched by the World Health Organization, there were more than 150 countries that were endemic for polio, with more than 350,000 polio cases that year. We're at the knife edge of total eradication of polio from the world. We're not there yet, but this is a really big stepping stone towards that goal. The declaration of Africa as free of wild polio virus.
So are you able to talk to us about the conditions that were considered, of course, when declaring the continent wild polio-free?
So in order to certify a country, each country, firstly, as wild polio virus free, and then the continent as a whole, every country needs to document that they are looking very hard for polio in any child who has paralysis or weakness for any other cause or reasons. So there's been a lot of hard work through surveillance, meaning screening paralyzed children and children with muscle weaknesses to look for polio, which has been going on in every country in Africa for the last 3 decades. Even when countries didn't even have wild polio virus anymore, we still look in every child with weakness for any cause for polio virus. So there's been an intensive surveillance for polio virus over the last decades, which has led to the confidence of the African Regional Certification Commission in declaring the region free of wild polio virus.
All right, but also maybe you can also, Doc, sort of clarify this for us, because we keep emphasizing the fact that it's wild polio virus free. So it's not the entire polio in its entirety, because we understand that there is still that minor strain that still affects and infects hundreds and hundreds of people, isn't it?
There are still circulating minor strains that we are still endeavoring to get rid of, but the number of cases that were paralyzed by them this year is less than 100. So, in comparison with the numbers we used to see from wild polio virus, it's very small numbers, but those minor strains do cause outbreaks, and those outbreaks need to be responded to with urgency.
All right. So how do we ensure that we don't take a step back from this victory that we're reporting on now? Because if my memory serves me well, Doc, the same had happened in India, but years later the virus sort of reared its ugly head once again.
Sorry, I didn't hear the end of that question.
Yeah, I was saying that
Can you repeat?
how do we ensure that we sort of don't take a step back from this victory that we're reporting on today?
Really, it's around continuing our routine vaccination programs, ensuring that every child has access to vaccinations, and remembering that even despite the COVID pandemic, vaccinations are essential healthcare. And although, we all fear COVID, but COVID is relatively kind to children, whereas the other childhood diseases against which we vaccinate are not. So we really, the message is that we can't relax our guard. We need to continue vaccinating for polio, and we need to continue vaccinating for all the other childhood diseases included in our routine vaccination schedule.
All right, I'm afraid time constraints, we have to leave it at that, but we thank you so much for clarifying this matter for us. Thank you so much for coming through.
Thank you for having me.